So in follicular lymphoma, we have been working for several years to define the genomic determinant of the precursors. And what we have found is that there are two main genomic abnormalities. First, they carry T1480 frequency, and when you carry a lot of those cells in the blood, this is really a definition of what is a precursors. And also, we have been able to define additional molecular alteration by looking at pre-diagnostic blood samples from individuals that will develop follicular lymphoma, and we have been able to show that they carry CREBP mutation as a second hit, and then to a lesser extent KMT2D loss of function mutation. But the key two players in those precursor cells are really T1418 and CREBP mutation that are required very early on, and that give rise to the disease from 1 to 10 years after the acquisition of the mutation. So basically, when we have done this survey of characterizing the follicular lymphoma precursors in pre-diagnostic individuals, we had a control population which carry also the T1418 positive cells in their blood, but they do not develop follicular lymphoma. And the main differences was really the acquisition of secondary alterations. So the T1418 is present in almost every healthy donors at various frequency, but the acquisition of the secondary hit CREBP was really a driving and a signature of a commitment to progress into follicular lymphoma. So I would say that if we want to identify patients that will develop follicular lymphoma in the blood, combining and finding the two alterations would be key, and we can do that by deep genomic sequencing. So in follicular lymphoma, we are not so advanced in treating patients. It's not like in multiple myeloma where some of the precursor conditions lead to some treatment, but in follicular lymphoma we are less advanced. We are just characterizing right now the precursor cells. We know that they exist, we know that they can persist post-therapy, and we are exploring ways to target those cells that persist post-therapy rather than treating patients before they develop the disease. So we are at that stage characterizing the persister cells post-therapy as a way to potentially intercept the disease and prevent relapses.